Now, what about knees and elbows? What could you tell us about those?
Well, my practice, again, I practice general sports medicine, and so I see injuries all over the body.
Yes.
As it turns out, most of the injuries occur, at least from what I see, in the shoulder and the knee.
Yes, okay, shoulders and knees.
I would say that makes up probably 70–80%. But certainly other joints get injured, and I see quite a lot of elbow, hip, ankle, wrist, and they all kind of have their own sort of injury types and injury patterns.
Yes.
And they're kind of separated into traumatic, sort of acute problems,
right, okay,
and sort of repetitive use problems. And the knee is no exception. The knee, I can easily divide into the types of problems I see that are repetitive, overuse type things, and then traumatic things. And I think that strikes me the most about the repetitive type injuries, or so-called overuse injuries, is they're really not so much an injury of people doing too much. It's people not taking the time to adapt to the type of activity they want to do, and they get hurt. Like somebody that hasn't run for 20 years decides they want to do a half marathon in 3 months. The body doesn't compute that very well. And it has a tendency to get injured.
And like springtime baseball, they go out the first day and they pull a hamstring rounding first base.
That sort of thing.
Yes. Do you think that another reason for many knee injuries is the fact that people don't know how to use the right parts of their body to do certain movements? Like they use their quads instead of their hips and glutes to do squats and jumps, and they overdo their knees, or else they get, like girls, a lot of times their knees will cave in when they land. You find that with a lot of female basketball players or volleyball players. Do you see that a lot yourself?
Well, yeah, there's no question, and those differences play out in both non-acute and acute type injuries. But we know for a fact that girls, for instance, you mentioned the sort of knock-knee landing situation. We know girls tear their anterior cruciate ligaments disproportionately more than boys, particularly once they start puberty and become more like women than little girls. The incidence is something like 8 times what it is in boys, and it has a lot to do with the way that they use their muscles. They tend to land a little bit more upright, which doesn't allow a good co-contraction between the quads and the hamstrings.
Exactly.
And as a result, they get injured more. There are some positive results coming out of training programs to help teach sort of proper muscle use and mechanics.
Yes, that's proper biomechanics. I think people are more aware of that now than they were 10 or 15 years ago.
That's right.
So I remember back in the bodybuilding days, like in the 80s, every sport was trained as if they were bodybuilders. Everybody did bench press and squats and, lat pull downs and those types of things, and they weren't really trained functionally.
Yes.
And then in the 90s, one of my teachers said, you guys are going to be the pioneers of functional training. This is strength that you can use rather than just getting big. And so things have actually improved a lot over the last 10 years or so. You played baseball, so a lot of shoulder disproportionate flexibility and mobility comes into that, doesn't it?
Yeah, the act of throwing is sort of universally understood as unnatural, and it does things to the joint. There are forces across the shoulder joint that you just don't see in any other sport.
You have to decelerate all that every time you throw.
You have to decelerate. You have to the slinging motion of throwing a baseball is different than, say, throwing a water polo ball or a football or a basketball, and the amount of torsion around the shoulder is extremely high. The stresses on the shoulder, the amount of external rotation or bending back that way is extreme and puts a lot of stress on the joint.
Yeah. So how about ankles? What types of injuries do you see mostly with ankles, and like soccer or or baseball or football? What do you see happening on
Yeah, it's interesting. I think, one of the biggest issues with ankles, I think, and it's sort of my own personal take, so I did a lot of research on this when I was a resident, is that shoes tend to disrupt sort of the normal biomechanics of the ankle, if you will.
Yes.
We weren't designed with shoes in mind, and we certainly aren't born with Nikes on our feet.
That's true. I agree. Yeah.
So what happens is, I think, with shoes on, while they do have some positive effects, one of the negative effects is that we no longer feel the surface that we're on.
Right.
And the soles of the feet are extremely sensitive. The sensitivity is something like 600 times what it is on the skin of our thigh, for instance.
Yeah.
And that ability to differentiate even little discrepancies in the surface is a very protective effect, as you can imagine, on the ankle. And it's very difficult to roll the ankle over or turn it if you can feel exactly where you are on the ground.
Right.
And so shoes of any type are going to rob your ability to sense the ground well. And unfortunately, it's not practical to go barefoot in most of what we do, but it's something to be aware of, and to probably work even harder to strengthen the muscles around the ankle so that they're less likely to give out.
I see.
And sports like soccer are pretty good because the shoes tend to be fairly flat and thin, so there's still a little bit of transmission of the pressure and the feeling through the shoe, but it's still a problem. I think that's the fundamental issue, is just not being able to feel the ground the way we should.
Yeah, there's people teaching the kettlebells now who will not let their trainers use running shoes to train with kettlebells. You have to have flat shoes like board shoes or tennis shoes, or something that's not built up.
Right.
And since I've been doing that, I used to have like worse sciatic problems, and that's kind of almost disappeared just by changing from running shoes to flat shoes.
I see you got your board shoes on.
Yeah, right. Because
Well, I mean, that's again, it was the research that I did was actually on runners, and I had them run with running shoes on and then barefoot, and I did it in a laboratory environment in a state-of-the-art gait analysis center up in Hartford, Connecticut, where we had force plates embedded in the ground, motion analysis cameras, video cameras, and I just had them. They had no idea why they were doing it.
Oh, that's neat.
But I had them run in their shoes and then barefoot.
Right.
And there was 30% more force on the knees with their shoes on than when they were barefoot.
Okay.
Just that little bit of elevation in the heel kind of pitches the body forward and puts a lot more force.
That's another thing. That's another thing. Yeah.
I think that might have something to do with the sciatica that you're experiencing.
I agree. Yes. So even for running shoes might not be that great, huh?
I am not a big fan. No.
Yeah. What about, have you seen those shoes with the toes in them, the toe shoes?
Yeah, the 5-finger shoes.
Yeah. Have you ever done them? Have you ever tried them?
I haven't tried them. I've done a lot of barefoot running because I grew up on the beach in Santa Barbara, so that's where I did all my running. My concern with the 5-finger shoes is that unfortunately we spend most of our time in Western society with shoes on.
Yeah.
And certainly when we're trying to do anything with as much impact as running. And if you go straight from having your feet entombed in regular shoes all the time to going straight to those 5 fingers, I think that they can create some issues if you try to just go straight away and run. So
there needs to be a transition period, and they don't really tell you that when you buy the shoes either.
No, and it's just like what we were talking about earlier. I mean, the soft tissue body adaptation to an activity is critical, particularly as we get older, which I'm starting to learn about. But I think they can definitely be effective, but in our sort of hurried, busy world that we live in, we don't take the time to really do things properly. But the key there is with something like a 5-finger or barefoot, it really teaches you what it feels like to run properly, where your heel is touching the ground last instead of first, and the change in force that goes through your body with that's much more protective and conducive to pain-free longevity with running.
Yeah, so I remember in the old days of personal training school, they told you that your foot strike was like heel, then it goes out, then in, then out again. That's the way they designed running shoes. But you're saying that when you run, your heel should not hit the ground first.
Well, again, if you look at the results of my study,
Yeah.
and you can, and they're very good results.
Makes sense.
And you can only go by, again, these runners had no idea
Yeah.
why they were running barefoot or why they were
Uh-huh.
running in shoes. And to a person almost, when they took their shoes off, they no longer landed on their heel.
Yeah, did
'Cause
they
that's
land like on
painful.
the ball of the foot?
They landed
and
on the
then-
ball of their foot, and so that it absorbed all the energy through their Achilles tendon and their calf.
Yeah.
And so it begs the question to me, well, if they're landing that way when they're barefoot, and we were designed by our maker barefoot,
Yeah.
maybe that's the way we should be running.
Good
and,
point.
and when we have shoes on, we should run that way, not the opposite. I think the reason that running shoes allow us to land on our heel is because when we walk, even barefoot, we walk heel to toe.
Oh, yeah. Okay.
And human beings are lazy or want to be efficient, however you want to put it. And when we have shoes that protect our heel, and we go from walking to running, we're still going to land on our heel.
I see.
Because it's just more efficient, if you will. But it also sends a lot more force up into your knee.